I'm Della Clopton. I'm a nursing student at Central Texas College, and today I'll be demonstrating how to put on sterile gloves. Okay. The first thing I do is perform proper hand hygiene. Now once that's completed, I will set up my equipment on a table that is at least waist height or higher and make sure that it's clean and ready to set up. Okay. The next thing I do is grab my gloves and evaluate the integrity of the packaging. That looks good. I'm gonna make sure there's no holes or damages to the packaging. I make sure I have the right size. That looks good. I also want to verify the date on the packaging is still good. Looks good. And then I want to verify with my patient that she's not allergic to latex. Okay. All right. Now I begin to open my package. You want to open your sterile gloves away from your body. And remove my gloves from the packaging. I'll then open them and make sure my left is on my left side and my right is on my right. Okay. I'll then push the top flap away from my body and the bottom flap towards my body. Okay. I'll then pull the middle flaps using only the 1-inch border to carefully open my gloves. Okay. Okay. I would then begin to glove my right hand, which is my dominant hand, only touching the inside of the glove. Okay. And the glove, hold away from your body and above your waist. Okay, that looks good. All right. Now I will take my clean sterile glove to lift up my left glove. Okay. Keeping my thumb back to make sure that I don't contaminate my dominant glove. Okay. Go ahead and proceed. Right. Be very careful not to touch your skin. And then once you're complete, you just cup your hands and hold them to the side. Okay, now that I have donned my gloves, I'm going to duck my gloves. Okay? Which then I'll pinch in the center of my dominant hand and remove my gloves, careful not to snap. Okay? Then use 2 fingers of my other hand to carefully remove my other glove, not touching the outside of the glove and not snapping. Okay? Now that I've completely removed my gloves, I will perform proper hand hygiene. All right?